Good afternoon and thank you. My name's Pei Kamrani. I'm a PGY4 resident at Penn State Dermatology in Hershey, Pennsylvania, and I'll be presenting on a survey that we did looking at resident-reported training and exposure to gender-affirming care in dermatology. Oh, thanks. I have no disclosures. Over the past decade, there's been an increase in the number of openly transgender patients, with about 1 out of 250 adults identifying as a transgender individual. We as dermatologists play a significant role during this transition by providing essential medically necessary treatments before, during, and after the transition. And this also includes minimally invasive gender-affirming care procedures, which have been shown to improve the quality of life as well as the well-being of this historically marginalized group. These procedures include neuromodulators, which can help change brow position as well as reduce masseter bulk to create a more defined jawline. It can also include fillers, which can be used to contour the jawline, alter chin and cheek projection, as well as to be used to enhance tracheal projection. Despite this increase in openly transgender patients, there are currently no ACGME requirements looking at education for residents when treating this population. So exposure to these procedures during residency has never been evaluated, so our objective was to investigate what residents were exposed to, whether they were observing procedure, whether they were performing them themselves, and what sort of education they were getting in training regarding LGBT dermatologic care. Specifically, also wanted to look at if patients were getting a lot of exposure, were they feeling more comfortable to treating this population post-residency. So we sent out a survey to all dermatology residents in the US and Canada from October 2022 to December 2022. We used REDCap and SPSS to collect and analyze the data. We received about 233 responses. We had a similar representation for all years of training as well as the program region, but we did have an overrepresentation of urban and academic centers. Over 50% of residents that replied stated they received less than 3 hours of education regarding LGBT care per year. The two top procedures for gender-affirming care performed by dermatology residents were laser hair removal and soft tissue augmentation. So this graph on the right represents the number of procedures done during all 3 years of residency that were either observed, which are in gray, or performed by the resident, which are in yellow. You can see that 72% of residents have never performed a minimally invasive gender-affirming care procedure throughout residency, but 93% of residents reported that they want more training in this and more education. 60% of residents have never been able to even observe one of these procedures throughout their residency. So however, despite the really low numbers of either observing or performing these procedures, there is a decent amount of LGBT education going on in residency. Only 1% of residents reported that they haven't received any formal training regarding dermatologic care for the LGBT population. So this table goes through the different percentages of what residents were exposed to, with online modules and didactics and conferences being the top modalities. Unsurprisingly, we did also find that as the number of educational hours throughout residency increased, residents felt more comfortable treating this population. So in conclusion, our survey highlights the paucity of dermatology LGBT training in residency. Specifically, we found 2 new reasons for implementing more ACGME training for this. One, we found that there is a strong resident desire, with about 93% of residents wanting more education in this. And 2, we demonstrated that as you have more hours of education, residents do feel more comfortable. Some solutions include more didactics, online videos, or attending conferences where these procedures are being done. Some limitations include a low response rate, small sample size, and self-selection biases. Residents that are more interested in this topic were more likely to fill out the survey. Thank you so much.